Hello, everyone. Yeah, you're welcome. This is just to announce to you that you may not be able to use your microphones or your videos. Do not worry about that. You are allowed to raise up your hand if you need to talk, and then you be able to use your microphone. Also, you can send in reactions to react to whatever the speaker is saying. And if you can't speak for any reason, you can leave your message on the WhatsApp group or your question on the WhatsApp group. It's going to be attended to. Hello, everyone. Welcome once again. You might have noticed that you're unable to use your microphones or your videos. That is intentional. So you're allowed to use the reactions. And also, if you have a question or you want to make a comment, you can just raise up your hand and you'll be allowed. You can just raise up your hand and you'll be allowed to join. Yeah. So you can just raise up your hand and you'll be allowed to to speak, sorry, you'd be allowed to speak rather. And also, if you want to make a comment, maybe you can no longer hear the speaker or just anything that does not require you speaking, you can just send a message to the general group chat. It will be attended to. So thank you.
Good evening, everyone. I am Ebine Favor. Please let's react if we can hear me. Let's Our emojis. Okay, thank you very much. So I'll be our moderator for the first session, which we'll be holding today. So we'll give about 4 more minutes for more people to join the call before we start officially. Thank you. Good evening, everyone, and welcome to the very first section of the health literacy and emergency response training. I hope you can hear me now. Okay, so we're going to be starting right about now. But before then, I would have actually loved to ask us about some things we learned from the very last session, which held last week. Two things you learned from last session. Quickly, if you want to, please raise your hand. Okay, I can see a couple of people. Okay. Abdullahi Ahmad Isa, please speak. You can speak now. Abdullahi, you can mute yourself and speak. Okay, I'm not sure the person is on the call or here presently. Okay, who else would like to speak? Okay, Abib. So you can use your mic now, Abib. I've given you access to your mic, so please speak. Yes, please, you can unmute yourself.
Thank you very much. Good afternoon.
We can't hear you.
We learned about how. Sorry. Good afternoon. Can you hear me now?
Yes, we can.
Can you? So last week we learned about how to go about policy implementation. The speaker, the keynote speaker, he talked about when trying to like implement a policy or trying to find a solution to a particular health problem in our community, we should ensure that our solution is something that is systematic. That means something that addresses the root cause. Then another thing he said that our solution must also be replicable in other scenarios. Yeah, that's what I learned.
Thank you very much for that awesome point. So, like, because of our time, we would have to go to the proper item for today. So, the first thing we'll be doing is introduction. I'll be introducing myself as well as my speakers. So, we have our first speaker on the call, Dr. Olawale Ogunlano, who will be taking us on introduction to health literacy. So I would like us to do well to listen, to be in attendant, to be attentive. Okay, I did not introduce myself. My name is Ebine Favor, and I'll be moderating the session of today. So if you have any questions, you will not be able to drop in-call messages. So I would say you should drop it on the WhatsApp group. The questions will be attended to there. And also you can raise your hand when it is time. So you can be given audience to ask your questions, which will be attended to. So we'll be going straight to the citation of our speaker. Okay. So our speaker, Dr. Olawale Ogunlano. Dr. Olawale Ogunlano is a licensed medical doctor, media innovator, and creator who is pushing the boundaries of health access and reliable digital information in Africa. With over a decade of clinical experience, he founded HealthCraft, a digital health media agency that helps individuals, organizations, and governments promote digital health literacy, amassing a digital following of over 400,000 across all social media platforms. Dr. Ogulano's signature approach, which is insightful, explanatory, and captivating, has established him as one of the premier health advocates in Africa. His expertise is highly sought after by health-conscious organizations, both locally and internationally, leading to impactful partnerships with entities such as UNICEF, Dushwell, PZ Cushion, Merck Pharmaceuticals, Baines Microfinance Bank, the Ogun State government, and the West African Health Organization, WAHO, and WHO, which is World Health Organization. He has played a vital role in establishing essential health facilities, including Cavesbury Hospital in Nigeria, and he continues to champion the cause of equitable healthcare access for all Africans. As a one-time health tech co-founder of the 100K Club, a member of WHO FIDES, Dr. Ogulano successfully bridges the gap between health education and access, inspiring transformative behavioral change within communities. Now, with our virtual rounding over plus, let's welcome Olawale Ogulano. Over to you, sir.
Okay. Good evening, and thank you. Thank you very much. I want to be sure you can hear me properly. I just want to be sure you can hear me.
Yes, we can hear you, sir.
All right. So thank you. Thank you so much for that. Thank you for the presentation, and thanks to the leadership for having me here. Thanks to EOhealth Hub and Dr. Emmanuel for helping make this happen, and for the privilege. It's always a big honor to be here sharing thoughts about health literacy, and just to give us a kind of like an introduction to what health literacy is. Personally, for me, I always say that slideshow is one thing, and practical approach is totally another thing. So I would prefer a situation where people can, as long as you are here, you pay good attention, because while we are talking with slides that's probably generated by any chat GPT, the most important thing you want to take from today's session is the experience, and maybe that experience can help you fly where we walked. So some of us, because when we started this journey, it wasn't pretty defined up until now, when things have become a bit more smoother. So my strong belief is that people that are going to be coming behind us are going to be soaring. It's going to be easier, because people like us have been able to do our part to blaze a new trail. So my name is Dr. Olawale Ogulano. I'm happy to be here, and I'll be sharing with you introduction to health literacy. If you permit me, I'd like to share my screen. Looking at my slides. Okay, so let me see. I would like to share this in full slideshow. Okay, so all right. So thank you, and I hope everyone can see my screen. Please confirm that you can see my screen, so that we can proceed. Good. Fantastic. All right. So this is introduction to health literacy. So the first thing that I would like to let us know is that Africa has a health literacy problem. Africa has a very big health literacy problem. One of the things that made me to really step out into the world of digital health literacy and health literacy generally was the fact that I saw a man. I think that was in 2023 or something, and this man, instead of him to come to the hospital, apparently he thought he had typhoid, and instead of coming to the hospital to run certain tests, maybe do a full blood count or something, he just kept drinking agbo, and it's the symptoms worsened. So I think he had compacted stool, so like the stool was impacted, and then he had ruptured appendix, and that was when he now presented. The moment he could no longer go to the toilet anymore and his tummy was getting bigger, that was when he came to the hospital. And he was very lucky, because after after a care of 3 months in the hospital, repeated X-lap about 2-3 times, and in care management of close to 1.2 million, which he couldn't pay eventually because our hospital had to let it go. He survived. But then the question was, if he had known better, maybe somebody had told him, or he had access to resources to know that, oh, if I'm feeling like this, maybe I need to get to the hospital and see the doctor first instead of me taking Agbo the next thing to do. So that was one of the reasons why I decided, you know what, I'm going to step out and try to solve this problem in my own little way. So yeah, and this is just one person. There are so many people like, this particular man, let's call him Mr. Hakim for all purposes. There are many Hakims in Nigeria. There are many Hakims across Africa. And it's a growing problem because health literacy in itself, by definition, talks about the degree to which individuals can obtain, that's one, process, two, and understand basic health information and services to make proper health decisions. Okay, so the first thing is to obtain it. First of all, we have a lot of people that are online. People are online. Another thing that I realized is that a lot of people are online. 8 out of 10 people are actually with a smartphone today. But what happens is that when they go online searching for information, they don't find information that is relevant and contextual to them. So back then in the years, I think about 6 years ago, if you had gone to Google anything regarding, healthcare or something, right, a health advice, you would likely see Medscape or something that is so ambiguous, it's not contextual, people can really understand it. And then also the information, the type of the content itself was not engaging enough to warrant interest. Okay, so the first thing is individuals must be able to obtain it. Number two, they must be able to process it. And that is where we talk about, big jargon. You open Medscape and imagine a patient, a random patient goes on Medscape. What is he going to learn when he gets on Medscape? Apparently nothing, because they are using all complex medical jargon there. And it's only healthcare professionals or people that are in this space that will have proper understanding of that, right? And then because of that, complex jargon, they can't understand whatever it is. And because of that, they're like, what the hell? There's really no need for me to process or to look for this health information. Well, let me just go to my nearby chemist and whatever it tells me, that is what I would do. So the most important thing for us here in health literacy is to bridge that gap of public health understanding, where people can understand this is what is probably wrong with me. This is the next step that I need to take. This is what I need to do in this particular situation. This, I do not need to take this, or I do not need to do this. Rather, I need to do that. It is very important. Health literacy is what grants people the ability to make health decisions that will be to their benefit. Okay. So, there are two types, actually. There's the personal health literacy, and then there's organizational health literacy. But for all intents and purposes, we are going to be talking more about or reflecting on personal health literacy. The fact is that it's a global problem. Health literacy remains a global problem even today. And I would say this is affecting the developed and underdeveloped countries like Nigeria. So, but the way its health literacy affects developed countries is not the same way it affects underdeveloped countries. So what do I mean by this? For developed countries, for instance, what they suffer from is largely misinformation, right? So they know that this is what needs to be done, but then there are a lot of fake news, fake information. People come up with different dietary supplements that are magical, that can transform you, in 20 days and stuff like that. You see the rise of anti-vaxxers and people that say that vaccinations are all out to kill you, stuff like that. That in itself is also a health literacy problem. It is a literacy problem, but not literacy from the side of these people are illiterate. But when you come to underdeveloped countries and, countries in Africa like Nigeria, in our own context, you see misinformation in the form of ignorance. They are just largely ignorant. They don't know. Nobody knows. In fact, they'll be like, what is checkup? Kidney checkup. Like, somebody will ask you that, what is checkup? Why do I need to go for checkup? Like, it's something as simple as that. They don't know it. They don't know it. Even tests that they need to do. Oh, you need to go and do tests for so and so. You're about to you need to do this, you need to do that. Like, you need to run certain tests. If you have a cough, if you have a cold, you need to do some certain investigations. They don't know that. Nobody knows that here. So in the underdeveloped world, like where we are right now, what we experience most is ignorance, right? And lack and malinformation, right? And malinformation. So these are some of the big things that we are seeing, and these are disparities that we see generally. So some people think that health literacy is only important in the context of underdeveloped countries, but no, it is actually, it's a global problem. It's not only affecting underdeveloped or developing countries, it's affecting the developed countries like the US, Europe, like UK and other, countries that already have established health system and a thriving healthcare infrastructure, like a thriving healthcare system. They are also suffering and having this problem. So now, like I said, not every health information is useful for the patient. And I'll put it like this: not every health information available for the patient is useful for the patient. Okay, and like I said, health literacy has become a central focus, even with the WHO. I happen to be part of the FIDES team, and the goal of FIDES is, to raise good health content and battle misinformation. Because now, on a global scale, it has been, it's been realized that health literacy, especially after the COVID-19 pandemic, it has been discovered that health literacy is a global problem. And to fix it, we ensure that medical professionals are given the ability and the skills and the tools to be able to bridge that gap in health information so that the patient can have adequate health information to make the right health decision. All right, so let's continue. Now, there are certain barriers that people will face when it comes to health literacy. Number one is language barriers. That's, hinder health communication. Right now, before in Africa, this was a problem because the context of information was not present, but it is currently changing. There has been a lack of specialized education, leading to difficulty understanding medical jargon. Like I mentioned earlier, a lot of people would not understand what hemorrhoid generally means, but they might understand jedi, right? So sometimes breaking down this medical jargon into proper context, and by the way, there are different meanings of jedi, and up till now, even if you ask me, we still don't know the full meaning of jedi, because the direct translation is funny, but then it can mean many things. It can mean anal itching, it could mean hemorrhoids, but largely it's always referred to hemorrhoids, right? But back to what we're discussing, a lack of specialized education can lead to difficulty in understanding medical jargon. When doctors are speaking most times, especially in the consulting room, you don't have so much time to talk to your patient. You have perhaps maybe 15 minutes, you want to see your patient, and you are busy talking about complex medical jargon like, the coronal artery, you have plaques. Your patient will just be looking at you. What is plaque, my dear doctor? Can you please explain it to me, right? And in health literacy format, you can just say that, the pipes that take blood, that supply blood to your heart has been blocked. Just imagine that, there is certain blockage, like something has clogged it and blocked it. It's different from just telling your patient that, you have plaques, so you have atherosclerotic plaques. My dear, what do they want to use that information to do? Okay. So these are some of the things that we face, and these things happen every single day. But we don't know it, we don't see it that way. And that is why there is always that gap. Even a patient might end up going to the doctor and becoming more confused because of proper health literacy skills, right? And this should not be the case. Cultural differences also may lead to distrust and misunderstanding of healthcare practices, and then access to health information, access or limited availability of healthcare resources can also be a problem. And these are some of the things that we are trying to fix, right? Now, what are the things that determine health literacy in any population, in any given population? So there are a couple of things. Number one, the level of education is very important. A higher level of educational attainment usually comes with better health literacy, always. And then we understand that if we look at from the context of Nigeria, education has become, is a problem, because certain areas, like for instance in the northern region, there are challenges with education, even areas in the southwest and the south. So we see that there are discrepancies with regards to education or levels of education, and this plays a very big role with health literacy, because there are certain contexts that when you are educated, you get exposed to different scenarios, to different areas of networks, to different areas, to different environments, and part of that environment almost always involves healthcare awareness or healthcare checks, right? So a lack of education, a lack of education can also be directly related with a lack of healthcare education too. Income is also a factor. Individuals that have higher income are more aware, because of course, who wants to die early? People who earn more money are generally more aware about their health and try to do something about it. So they get a greater access to healthcare information, especially now that we are in the digital age. They have access to digital devices, mobile phones, laptops, and all of that. It is said that with the access to digital devices and to people connected to the internet, because right now we have about 5 billion people that are currently connected to the internet. Over half of the world is connected to the internet. It provides greater access to health information. Also, community networks and support systems can also help to create understanding, because for instance, if you are in a community where there is a hospital and that hospital gets to do outreaches from time to time, of course you will be exposed to some certain level of healthcare knowledge and healthcare literacy. Okay, let's continue. All right, so promoting health literacy. Professionals, this has been a problem generally, and this was one of the reasons why I had to get into this space. I had to get into the healthcare space to talk about to really focus on health literacy, because I noticed that a lot of professionals, especially doctors and nurses and the real arbiters of health knowledge, they were too busy. They were too busy to simplify medical instructions and put it into plain language. They were, because of, and it's not really their fault. It is a mixture of being too busy due to lack of, due to like a heavy burden. The patient and doctor ratio, is really on a very high side. You have, close to about 2,000 patients to one single doctor, and even more than that as of today. So how many doctors will have time to really simplify medical instructions and put it into plain language? And how many times would they be able to repeat that successfully in a single day? And also, it takes a lot of time and effort to utilize proper visual aids and interactive methods to explain complex information. I had to personally spend about 2 years learning how to edit, learning how to curate, learning how to create, learning how to edit and publish engaging health information that will be relevant to people. Okay, so yes, you do need a little bit of time and a little bit of effort. I don't know if I'm actually oversimplifying it by saying a little bit, but you do need there's a certain level of effort that is needed to make sure that these visual aids and interactive methods are there to explain complex information, because at the background of it all, medical information is largely complex, very complex, and very hard to explain. So taking time to explain these things and bringing it down into simple terms requires a whole lot of effort, right? All right. So, and then now you being able to to break down complex information is one thing. Being able to to break down complex information into multilingual resources, into contextual information, for instance, into Yoruba, into Pidgin, into English, like simple English, into Igbo, and into any contextual information that we are talking of, requires, across diverse population, requires a whole lot of effort. So, and that is why, we are currently leveraging technology and trying to use technology to ensure that these things are available. So, usually when complex information are being broken, it can be broken, different types of media materials can be used. So there is digital or social media, and then there is traditional. So if we start with traditional media resources, we are talking about physical learning materials, and paper, that is paper and print, right? We are talking about paper and print. So that is why some places in advanced, especially in advanced healthcare systems, there are a high there are increased amounts of physical learning materials and equipment in paper and print format that helps patients who are going through particular healthcare that need healthcare resources to understand certain diseases or whatever it is that they are going through. That is one. But then the fact is, traditional media has its limits. Materials have little flexibility because of creative art and style and the volume of information that can be put into a single piece of paper or print. And then there is also limited access to educational materials and information per material. However, for digital media or social media, it has a greater or higher level, it has a lower barrier to access for educational materials and information. Social media, I mean, everyone can log in. If you have an account, you can easily get there. Through the internet, there are more available channels for effective communication and engagement. And then algorithms, social media algorithms. I know it has not been explained to anybody before. But social media algorithms is like you tuning your radio station. If you were like a millennial like me and not a Gen Z, you probably know what it is, tuning a radio. When you're tuning radio, you have to tune it. There's a way you tune it. You know that you're saying shh, shh. And then at some point, it will now become very clear, right? That's how algorithms work. Algorithms work to tune your social media to to the preferences of what you would actually like to see. So people who are always looking for healthcare information, they would definitely get a personalized kind of learning for, based on their language preference, their geographical location, and their specific needs. Okay. All right. So I'm going to rush through now so that it can be a bit faster. Social media for health literacy is becoming a very important thing. Even the WHO has understood that this is a very important emerging trend because social media platforms serve as powerful tools for mobilizing support and raising awareness about health issues. Right now, many youth-led movements are gaining momentum as younger people like you are increasingly demanding accountability and action on issues and systemic inequalities. Okay, so social media, learning how to use social media directly corresponds to directly corresponds to how much we can improve health literacy in our world today. How you can use digital media directly, like it's directly proportional to how we can improve health literacy in our world today. Okay, so like I said, there are over 5 billion people that are currently using the internet today. And right now, even the WHO has taken notice with the FIDES network, which has been created to leverage social media for social good, bringing together healthcare voices from all over the world and providing them with material support to raise good health content and fight misinformation, promoting health literacy as a result. So now you say you're a medical student and you're asking yourself that, can I really get into health literacy? The answer directly is yes. And right now, at the point where students are, it is important to understand, right? engaging in outreach programs that can educate communities. Like I said, there are certain things that I will mention that are not even written in the slide, so they will be in record. Medical students can learn or start working on complex skills that will help them to communicate or improve health literacy for their either for their current patients or for their future patients. What I mean by that is, this is, I wish I was in medical school when, at this point in time, so that I could have learned or spent time learning different skills, including, complex design, video editing, graphics, UI, UX, language modeling, AI, and stuff like that, because these are some of the tools that would actually help health literacy become so much better in the coming years. Right? So, but then as future practitioners and medical students, you can engage in medical outreach, in outreach programs that educate communities about health practices. And in doing this, you can be able to get the skills in communication, because communication as a skill, or any skill, as with any other skill in the world, it has to be improved upon. Yes, some people have the talent, but then talent also has to be refined. If it is not refined, it becomes abysmal at some point. It is also important, medical students can also implement different types of modules to improve patient care understanding, or like when, study and test, because it's not even implementing them. It's about testing different patient education techniques that you feel will be helpful. And you can also foster environments that encourage questioning, especially as students right now. You can sit down and have, cliques and active participation in healthcare discussions. You can start practice. These are the best times where you can create practice environment that foster or encourage questioning and can improve health literacy on a one-on-one, especially when it's traditional. And then also build, networks where people can actually learn or improve skills that can improve digital health literacy. For instance, learning how to use social media, learning how to create content, learning how to edit videos, learning how to use, data, learning how to, data analytics and stuff like this. Very important in today's world. And learning some of these techniques, they can be very helpful. They can be very helpful in, improving your own ability as a health literacy specialist. Let me put it like that. So to simplify medical instructions for patients, one of the things you can do, number one, use plain language. Try as much as possible to avoid medical jargon. And this is one of the things that we are currently trying to do every single day, right? For instance, like I said, instead of saying hypertension, use high blood pressure, because a lot of people know it more as high blood pressure than hypertension, right? Instead of saying, for instance, you have atherosclerotic plaque, you can just say that, your blood vessel has a blockage. Something is just like a lint, or like something is blocking the pipes that supply blood in your heart. Use visual aids. The use of charts, diagrams, and images help to visually demonstrate concepts that can help in better understanding. For people that have, I've been creating videos for a couple of years now, and one of the things that we try to do is to ensure that we use, the reason why we use charts, diagrams, and images, even videos, to visually demonstrate concepts so that it can sink in, because audiovisual has a way of shifting. It always causes a shift. What you are exposed to on a frequent basis influences you. And we strongly believe that audiovisual has a very strong impact on, transforming mindsets. So the use of visual diagrams, charts, and images to visually demonstrate medical context can help to understand complex information. Then also, this is more physical, teach back method. After explaining certain instructions to your patients, you can ask them to repeat the information for you, so that so that this is like a feedback. It's a feedback loop. You want to know that you ensure that they understood what you are saying, and you weren't just throwing complex words at them. These techniques, this actually helps you as a person to know that, am I really teaching, or I'm just doing it for doing sake? All right. Then you can break the information, this is called chunk and check. You can break the information into smaller manageable parts. For instance, when I'm creating content online, one of the things that you'll never see me do is to throw all the content at once. For instance, if I'm talking about high blood pressure, I'm not going to rant for the next 10 minutes talking about the etiology of hypertension, the pathophysiology of hypertension. No, I will just put it as 3 things that you need to know about hypertension, and I will mention it, right? We need to understand that information, when given, when ambiguous, it loses its value. So breaking the information into smaller manageable parts can help, for understanding before you move on to a bigger segment, right? Number 5, use analogies, that is, employ storytelling. And this is where, we, especially for us, that have been on the digital health literacy journey, we use this a lot. Relate unfamiliar medical concepts to common relatable situations and objects. Using storytelling helps to allow the patients to remember, because humans are largely built for stories, okay? We love stories a lot. We all love stories. So, for instance, like I said, describe cholesterol in the bloodstream like a lint in a pipe, right? Using such kind of context will help people to understand and assimilate information better. Then multilingual resources. If you're speaking to a Yoruba patient, try to see if you can give them Yoruba resources. If you're speaking to a Hausa patient, use Hausa resources, right? Speaking in native language allows you to dial down context, and it can improve understanding. Then interactive tools like videos, digital tools, mobile apps can help to improve patient engagement and understanding using different interfaces. So for those that are interested, I say, okay, how can I leverage social media now for public good and for public health and for health literacy? The first thing you need to do is, number 1, you need to be educated. You need to know your audience. Education is key. You cannot explain what you do not understand. So for anyone who is saying that, oh, I want to become the next health influencer or the next biggest thing in the healthcare space, calm down. Be educated first. Make sure you understand everything. Understand medicine in itself. Know your onions before you can explain it. You can only explain what you understand, right? Then number 2, niching. You can choose an area of interest. So even if you are in general practice, as a technique, you can start somewhere and push again, move into another thing. So that way, it always keeps you being fresh. You can always switch or change later on. However, focus on a particular area. A focus on a particular area of healthcare always helps. Number 3, you need to skill up. Number 1, communication skills. Effective and engaging communication is very important. Set designs, script writing, video editing. They won't teach you all of these things in medical school, but these are the things that you have to go ahead and tell yourself that, you know what, I need these skills. Because left for me, when I decided to venture into this, I did not know what I didn't understand that I would need to polish my writing. I was an effective writer, but I didn't know that I still needed to polish it up. So I had to do that. I needed to know how to speak, how to tell stories, communication. I needed to improve, and not just speaking to my patient now, but engaging somebody that is just watching my video. All right. Video editing, I had to pick that up on my own. Took me a couple of while. I don't edit right now because I do have a team, and we work at Healthcraft. We have like an agency and people that are doing all of these things right now. But then at the very beginning, when you're starting your own journey, you might definitely need to know how to edit videos. The use of set design, lighting, script writing, social media management, understanding social media posting, analytics, algorithms, and all that are skills that they would not teach you. But then you would have to learn it someplace else, okay? Then the 4th thing you have to do is to be consistent with it. It's like hitting a nail on a single spot. The thing about consistency is this. If you there are some people that when they say, I want to become, good at health literacy, and then they do it today, and then not do it again until 2 years after, when they now see that somebody else is doing well in it, they'll not be like, and I was doing this thing last year, you now do it again. You now start again, and then you stop. It's like hitting a nail. Imagine you as a person, you are hitting nail on a wall, and then you just hit it once, and then you start complaining that, it did not enter once, so I'm not doing it again. That is not how life works. Consistency is like consistently hitting a nail on a single spot and doing it every single day, even though you're not getting the result. Initially, it will look as if nothing is happening, but if you keep at it, success will come to those who are consistent. Then finally, for those who also want to leverage social media for health literacy, you need to learn how to collaborate. Because number one, even for somebody like myself, being in the industry for a long while, and despite all the collaborations and partnerships we've had over the years, we still don't know it all. So reaching out to people who have similar interest or work, who have similar interest in this, you work with them on specific projects, volunteer with them, learn and join mentorships. I was very happy to see that a lot of people joined, met me, and they said, oh, we like mentorships. Although some of them are, mentees can be very funny initially when they start. It's a problem of consistency again, right? It's another problem of consistency, because even mentorship requires consistency. So you see that some people want to be mentored, but then they are not consistent, right? Mentorship doesn't happen that way. But then these are, it's very important to know that if you're going to be leveraging digital media for public health and for health literacy, these are some of the key things that you need to keep in mind. Then the do's and don'ts that I would like to advise for future health specialists or health literacy specialists. Number one, do your due diligence. Make your research. Promote health information that is backed by evidence-based research and health information, not unfounded ideas. Okay, because you have to remember that you are a healthcare professional above all. You are a medical doctor, you are a nurse, you're a pharmacist, you are somebody, right? So you have to remember that you work and you operate by certain guidelines and work by those guidelines. Make sure you have access. Your information is backed to certain research that has backing, or that has clinical backing. Okay. Number two, as much as you can, do not chase clout. I know that you might see some of your role models in quotes doing this, but I would not advise you to do that. Do not chase clout. Always follow medical or ethics. Always. I saw a situation where creating content for so a patient, you don't use patients to create content. You need to learn how to anonymize health information. If you're a health literacy specialist, you must learn to anonymize information. The use of anonymical data is actually preferred than a patient waking up and realizing that you mentioned their name, you mentioned their age, where they came from, everything. You just put it up on public domain. That can put you into trouble. Creating content for enlightening for the public in an engaging way, it has to promote health-seeking behavior. You have to do it in an enlightening way, not in a crass manner. Do not violate medical ethics while promoting health information. Number three, also be updated with the latest trends. As a practitioner, as somebody who wants to be in the health literacy space, you must ensure that you provide accurate health information and make sure that health information is up to date and in line with standard health practices. So, in conclusion, we need to keep making sustained efforts in educating our populations and mitigating barriers. It is very important that we understand that health literacy is at the forefront of preventive health care in our world today. It is very important to understand that health care begins from the home, not in the hospital. It doesn't begin in the clinic. It doesn't begin in the consulting room. It begins right in the four corners of the home of any individual at home. So health literacy is that tool that helps people to make the right health decisions right at the beginning, at the very forefront of healthcare, when healthcare decisions need to be made. So sustained efforts in educating populations and mitigating barriers can lead to improved health literacy. And this is a critical component for achieving better health outcomes and fostering healthier communities. So at HealthCraft, what we've done is we are a health consortium that has, leveraged digital media to digital media storytelling and, visual tech to actually provide medical health information, reliable and engaging medical health, that is medical information for Africans. We initially just started as a creative studios way back in 2018, And then later on, when I went into the space, I discovered that there is a gap in, in engaging health content for Africans. And I needed to start that journey. And right now, we have built for myself and other creators and other influencers that have worked under our program. We built a community of over 500,000 people across social media platforms, and we have been at the back of some of the most viral health content that currently exists today, and also worked with partners, including the WHO, on very important healthcare projects. So we are definitely seeking to accept people into mentorships, and people who, especially medical students who might be interested in learning and knowing more about health literacy and its importance. We are also looking at how we can leverage, current tools in improving healthcare information and refining it for Africans. Remember that Healthcraft as we are, and the project itself for health literacy is for Africa. It's not just for Nigeria. So our vision is to speak Africa's health language, and we do this by providing reliable healthcare information. So if you want to be mentored, you feel the need to you want to learn, you want to know what it feels like working and providing reliable healthcare or health information for Africans, you can speak to us at Healthcraft. You can send a message or reach out through EOhealth, and then we'll definitely, or connect through to me through my channels at Olawales MD, and we will definitely be in touch. And you can follow Healthcraft also. I think it's Healthcraft _ on all social media platforms. So we are currently trying to build our presence and do that more, because we've been working behind the scenes since 2018. We've not had that need to really come out and say that this is who we are, that we are Healthcraft. But now the need is there, because we're actually building forward. And as a media tech organization, we are media first. So while we follow technology and we follow the latest trends, we are media first. So if this is something that interests you, feel free to connect to me and also speak to others. But meanwhile, I want to thank you all for giving me this opportunity to be here with you. I'll be happy to take in any questions, but thank you for having me. Thank you.
Thank you very much, Dr. Olawale. It was such an insightful session, to be honest, and I gained quite so much. And I think I'm one of the people that are interested in Healthcraft. So if we have any questions, please raise your hand so I can grant you access to ask your questions. Please, if you have any questions, please raise your hands. If you have any questions for Dr. Olawale. Living Faith, I want to be sure you are raising your hand. Okay. Okay, Shefia, you have the floor. Please ask your question. Shefia Abdulhamid, please ask your question. Okay, I think he's not asking a question. Ifeoluwa Ishola, please ask your question. Yes, you can unmute your mic and ask your question.
Okay, good evening, everyone. I want to thank Dr. Olawale for the wonderful presentation he gave to us. He said one thing at the conclusion. He said, if we have anything, or if we have any questions at all, or if we are ready to involve ourselves in health literacy, that we can reach out to him. So I need to know, like, how can we reach out to him? Do we get his number? Like, something like that, please, ma.
Okay, so thank you for that question. So the best thing will be, I would send an email through EOhealth, through Dr. Emmanuel, I believe, our convener, I will be sending him an email to reach out so that anyone who is interested in mentorships can write towards that, stating who they are, what they've done, and their interests, their core interests. And then we'll create more organized mentorships for those who are interested in health literacy and health promotion, using media and storytelling. So yeah, I'll be giving that email. I'll be sending it forward. I'll be putting it forward through Dr. Emmanuel. If I don't get to put it myself, I'll be sending that immediately so we can all be in tune. I hope that answers your question. Thank you.
Thank you
Yes,
very
thank you
much,
very
sir.
much, sir.
All right. So do we have any other person with a question? Do we have any? Okay, Habib Olalekan. You have the floor, Habib. Habib, you can speak. Habib, you can speak.
Okay, thank you, guys. Thank you, sir, for the insightful lecture. My question is that there was a particular time I was involved in an outreach program. So we were going around the marketplace, introducing to people the importance of oral rehydration therapy. Then, to my utmost surprise, there was this particular woman that was so like adverse to the even the notion of us coming close to her to like actually explain. She doesn't even want us to actually even explain, talk less of even trying to even introduce to her what ORT was. So like my question is now that how do we go about educating those kinds of people? Thank you very much, sir.
Okay, thank you very much, Habib, for that question. That's a very important question. One of the things that I think is important for us to note is that scenario itself denotes why contextual native health literacy or health information is very important. So imagine that I myself just at the forefront of health digital or health literacy right now. We are still making making content or relevant content in English. Right now, we are hoping that we'll have more people, healthcare professionals, make this content relative and engaging in Yoruba language, in Hausa language, in Igbo language, in every possible African language. And this is an ambition that we have at Healthcraft. We want a situation where we can, people can have access to the information that will transform their health decision making at the grassroots, at the very grassroots. Because if a woman like that, the truth of the matter is that there is a gap between, you are trying to explain something that feels far away, expensive, and foreign to her. It's not in our dialect. It is not contextualized to our situation. So she can't really understand that. So it is very important that we employ the power of storytelling, even within the context of native languages and different other scenarios that we feel that are relevant for people like her, right? So it is very important. All of these things that we are saying, all of these things that we are doing, we are not there yet, but it just highlights and it shows that we need to start thinking forward to ensure that if we want to ensure that people like that can make better health decisions, we need to meet them where they are by making sure that we provide reliable health information that they understand, that speaks to them. I hope that answers your question. Thank you.
Yeah, thank you very much. I understand. Thank you very much.
Thank you, Habib, for your question. Thank you, sir, for that very insightful answer. So we'll be taking the last question from Emmanuel Adiola. So please, you have the floor, Emmanuel Adiola.
Hello, can you hear me?
Yes, we can, please.
Yes, I'm Olumide Emmanuel Adiola. So my quick question is that with respect to the health digital literacy that we've been talking about, I actually have skills in like related to programming, that's R particularly and Python. So I want to kind of ask like how it can come in. You understand? Because if we are informing people about, like, if we are trying to make people literate about this health, whatever, there are datas we'll be working on, there are things to be working on. So I want to just ask, how can my, or where can my programming skills, like as a person now, versed in R and Python particularly. So where can it come in? Like are there maybe front runners already that I can be linked to or something like that that can also help with the health digital literacy we are talking about? That's my question.
Okay, yeah, that's fantastic. So to answer your question, your skills in Python and coding can definitely be used for interactive tools, especially for knowledge testing, for knowledge sampling, to know, or especially if you create a very important, like a very nice interface to it. You can create in like interactive tools that can test the knowledge of people based on health information and what they know. So this is just one of the few things that I know you can do. But if you want to break it down, or if you feel you want to be you want to really do something with it, you should reach out to me. I think just make sure you get my email from Dr. Emmanuel. Yes, so reach out to me, and then we'll be in contact, and we'll take it off from there. But this is just a simple, this is at the base, and like at the most basic. This is what you can actually do. So yes, your skills are very viable. They are they are sought after. I don't think right now we have any existing tools like that, but they should exist. But it's all up to you to make sure you put yourself to
Yeah,
good use.
because I was also about to ask that, okay, if it will not be R, of course, those are very powerful tools that even if it will not be those ones, since like I'm particularly fond of programming and something like that, coming
Yes,
from that aspect, that there
yes,
should even be other maybe tools that might
yes.
be in use. So something like that.
Yes, no problem, no problem. Let's have a conversation afterwards. So you should just reach out, and we'll keep it going, and we'll see how we can put it to good use. Thank you.
Um, can I chip in, please? Good evening, everyone.
Yes, you can, sir. You're welcome,
Good evening,
sir.
my chief, Dr. Wale.
Good evening,
How
sir.
you doing? Yeah, good evening.
Fine,
So
sir.
I just wanted to chip in that I don't know the name of the last person that asked the question. The person that is vast in R and Python, Emmanuel. Yeah?
Yes.
Please reach out to me
Olumide.
afterwards. Please,
Okay.
let's talk. I'm a health economist, so I'll tell you what you can use. I'm even looking for people that are good in that. So we'll talk about data analysis. So just reach out to me afterwards. But stay on. So we'll take my presentation. I'm sure you'll get more interested afterwards.
All right. Thank you, sir.
Sorry, my chief, Dr. Wale.
No problem, my boss. All right, but yes, that was a very good question, and I'm glad that he actually spoke out. Yeah, so you should speak to Muiwa. I'm waiting. I'm anticipating this session because it's going to be enjoyable, and you learn a lot about data. So do speak with him, and also please reach out to me. There are also some very fantastic ideas that you can play with, especially at this space where we are and at this time where we are in. You can definitely put yourself to good use, and yeah, and be a gold mine. Yeah, thank you.
Thank you very much, sir, for that amazing session. It was really, really insightful. So right now we'll be going on to our next speaker. So please, I'll be taking his citation now. Sorry, please, I'm trying to share my screen. Okay. All right. So Dr. Olumuyiwa Odugbeson is our second speaker, and he will be taking us on healthcare systems and policies. I'll be taking a citation. Dr. Olumuyiwa Odugbeson is a result-oriented health economist with extensive expertise in optimizing healthcare systems and enhancing business performance. He is also a certified digital health innovator and professional Scrum Master, adept at implementing value-based solutions for healthcare stakeholders. A graduate of Benjamin Association of Medical Students, BUAMS, in 2016-2017, after completing his medical housemanship and NYSC with the Lagos State government, he transitioned into health insurance, beginning as a care coordinator at Red Care Health Services, where he distinguished himself in Carson School of Medicine at Babcock University. Dr. Odugbeson served as Director of Socials in 2015-2016 and President of the Babcock University, coordinating high-quality healthcare delivery and driving business performance improvement. He later became the team lead for case management at Leadway Health, further sharpening his leadership skills. Dr. Odugbeson then pursued a master's in health economics at the University of York, UK, where he contributed to evidence synthesis for health technology assessment (HTS) and interned with the Adelphi Values, a global healthcare consulting firm. Following his MSc, Dr. Odugbeson completed MIT's Launching Health Tech Innovation Program, earning certification as a digital health innovator. This experience fueled the creation of Broad Street, the healthcare marketplace, aimed at fostering innovation in the healthcare sector. His passion for adopting agile methodologies in healthcare management led him to become a certified professional Scrum Master. Currently, Dr. Odugbeson serves as technical assistant to the Commissioner for Health in Ogun State, Dr. Tomi Kuka, providing technical expertise to improve healthcare programs and policies. He also spearheads the digital transformation of health records across Ogun State's public healthcare facilities. Known as the Wolf of Broad Street, Dr. Odugbeson is committed to advancing Nigeria and Africa towards universal health coverage by leveraging data-driven decision-making and innovative technologies to close healthcare gaps. With a sound virtual clapping applause, please let's welcome our second speaker, Dr. Odugbeson.
Good evening, everyone. I don't know if you can hear me. Good evening, good evening, good evening.
Yes, we can hear you.
It's a pleasure to be amongst you guys today, and happy start to everyone, especially the Christians online. I'm not sure if I'm going to go straight into my presentation, so I don't waste too much time. I think we're already 10 minutes into the time allotted. So as initially stated, I'll be taking you guys on health systems and policies with a focus on the Nigerian health system. My name is Dr. Olumuyiwa Odugbeson, and I'm sure my bio already captures my profile. But just to add, you can go to the next slide, please. A bit on my profile. I think I've already mentioned the fact that I'm a health economist, a certified digital health innovator, and a Scrum Master. I finished from Babcock University. I'm passionate about primary health care and also digital health in advancing universal health coverage. I consider myself a builder and a seller. Maybe I'll get some time to explain what that means. And also, I recently incorporated a company called Broad Street Tech Consulting, which is just basically focusing on data and technology, the use of data and technology in healthcare and also health innovation. I'm committed to creating value within the healthcare industry. And during my leisure, yes, I go to the gym. I play football sometimes, even though I haven't played in a while. Yes, I also create content sometimes, like Dr. Wale, but I'm still a small boy. And a fun fact about me, I'm the last of 12 kids. And I started driving at the age of 12. Unfortunately, I recently lost my dad, and the burial is next week. So um, currently mourning at the moment. So into our conversation for today. So I decided to start with this statement by Professor Lucas. This statement was made as early as 2001, and the question was, what is the state of our health system? Can things be better? And he said, the Nigerian health system is sick, very sick, and is in urgent need of intensive care. It is blind, lacking the vision of its goals and strategies. It is deaf, failing to respond to the cries of the sick and the dying, and it is impotent, seemingly incapable of doing things its neighboring states have mastered. Unfortunately, not everyone can speak, but if you agree that this is still how the Nigerian health system is as at 2025, can you signify? Okay, so I see a couple of hands, but we'll go into it and get a bit of understanding as to why this is so. So there are five major stakeholders in healthcare, just to set a bit of a foundation, right? So when you think about the healthcare sector as a whole, right, it's beyond just doctor patients, right? You have payers, who are the people that pay for the healthcare, which could be either the health insurance agency, or health insurance in a particular country, or in the states or in a country where there's no health insurance. It means the patients are also the payers, so they pay out of pocket. You have the providers, who are the hospitals, right? The clinics, the physiotherapists, the pharmacists. Well, not well, I would say the pharmacists in terms of the ones that sell the medications. So these are the people that provide the care. Then you have the policymakers, right? These are the people that provide leadership and governance when it comes to health. And then you have the pharma industry, who are the people that produce the consumables, the drugs, and all of that. And to be honest, that's where the money is. Let me just drop that there. But at the center of this, you have the patient, which signifies that everyone, whether you're a payer, a policymaker, or you're a provider or a farmer, whether you're a doctor, a medical student, or a lab scientist, or a nurse, right? At some point, you would be a patient, right? It means it puts you in the how would I put it now? The position of a customer. At some point, you would go to the facility to purchase healthcare. Next slide, please. Okay, so what is a health system? According to WHO, right, a health system consists of all organizations, people, and actions. Please note the parts where it says actions, whose primary intent is to promote, restore, or maintain health, right? So the system consists of organizations, right, whether public or private. The people within the organizations, I've just listed the stakeholders, and then the actions, right, whose primary intent right now is to promote, restore, or maintain the health of the general population. So this just gives us like a basic definition of a health system. Like when we talk about health system, next slide, please. So just to further explain what a health system is, it's a combination of a lot of things, right? We have resources, we have organization, we have financing, right? And of course, we have management. And all this culminates in the delivery of health services to the population. So it's not just one part, right? It's not just the hospitals, it's not just the patients, right? It's everybody, every organization, including the people that supply your medication in terms of what the quality, including the people that even make your BP machine, right? So if the BP machine vendor does not make accurate BP machines, it means it affects the kind of or the quality of care, right? You're providing for your patients. That's just an example. So it shows us how there are so many things that factor in when it comes to a health system, especially the financial part, right? Where is the funding going to come from? Who is paying? Is it the patient that's paying? Is it the government that's paying? And of course, what type of services are being delivered, right, to ensure that the populace or the general populace has access to quality healthcare at the basic level. Next slide. So I've decided to include like a more of like a framework, an architecture of what a health system entails. One, I start from the list, which is the foundation, the building blocks of a health system. In subsequent slides, we'll go into what these building blocks are, and I hope that as we go into it, it would help you understand better what we talk about when we speak about the system as a whole, right? Of course, well, I'm not sure if we're all just medical students or there are other medical fields here, but when we think about the human body, right, we have systems, organs, and all of that. So it's thinking about the healthcare sector as a system, right, that has building blocks, and then these building blocks are linked to intermediate goals, right? And the main goal at the end of the day is to improve health, and not just improve health, but health equity, which means that it's not just making sure that people have access to healthcare, right? It's ensuring that whether you're the richest person like Dangote, or you're the poorest person in, let me use my village, in Jebu, Agbewe, right? You should have access to the basic quality care. Now, whether the rich person can now afford to spend more money to get better or more, services, is still left to that person. But at the basic level, each individual should have access to quality care. And this would kind of underscore the importance of primary health care. And on the left and the right side, you have financial protection, which means that I should be able to access the care without running into debt. A lot of times we see people come on social media asking for help, trying to raise funds for kidney damage, for dialysis, for a cancer patient. So we see all of that. So the idea is that as an individual, you should be able to access care without having to lose all your money or borrow or having to sell all your properties or even going as far as begging or setting up a GoFundMe to be able to access the care that you need. And on the right side is efficiency, which has to do with whatever resources we have within the healthcare system. How are we putting it to good use, right? Whether it's funding, whether it's human resource, right? Whether it's data, how are we putting it to good use to make sure that with what we have, we are still able to deliver quality care. So let's go on and look at the building blocks. Right. So there are 6 building blocks of a health system, right? The first one is service delivery. Service delivery has to do with, how the patients are attended to, right? So we have primary level, we have secondary level, we have tertiary. Whether you're going to the primary health centers or you're going to the general hospitals or you're going to the teaching hospitals like Babcock or OUTH, or depending on whatever state you're in. Then you have the health workforce, right? Where you have the doctors, the nurses, the physiotherapists, the pharmaceutical, the farm technicians, pharmacologists, and all of that. So the health workforce, and of course, we know how that has been so far with the Jackpot syndrome and all of that. So apart from the health workforce, we have medicines and technologies, right? How do patients get access to medicines? If a patient comes, if you examine and all of that, at the end of the day, what kind of drugs are we giving? What's the quality? Is that the best drug to use at that point? So all of that come under medicines and technology. And of course, there's the financing part, like I mentioned. Who is going to pay? If a patient comes to your facility today, and if you become a doctor, I guess I'm still talking to students, so let me be in perspective. You become a doctor, a patient comes to you with a chest pain, you have a couple of investigations that you've seen in the textbook or that you've seen, you learned on word round to say that, oh, these are the kind of investigations you need to do to rule out something. And then the patient needs to take some drugs. But at the end of the day, the cost of everything is about, let's say, 300,000. And that patient is just someone that works on the farm. Question is, how is the person going to pay? Right? And apart from that, when we look at the supply side, who is going to fund the structures, right? The hospitals, who's going to ensure that they are running adequately, they have the resources they need to run, right? So that's also financing. And then we have health information system, right? And this is where data comes into play. I think at some point when they were reading my bio, it said something about the digital transformation of health records that we're doing in Ogun State. One of the reasons why we're doing that is because without data, you cannot make informed decisions. So these are major building blocks of a health system. And at the center of all of this is leadership and governance. And that's where you have, the people at the level of the ministry, whether at the federal level or at the state level, right, or at the local government level, coordinating the system as a whole, right? Being able to coordinate everything around it. So let's go to the first one, service delivery. Good health services delivery ensures what? Two things, quality and access, right? So it means the patient has access to quality healthcare and also so it's not just about you having a physician available, is can the patient get access to that physician, right? Is the person in the rural area able to see a cardiologist, for example? No. Do I have to go from Ogun State to Lagos or to Ibadan to go and see a rheumatologist, for example? So that speaks to access, right? And apart from that, the quality of care. After accessing that service, do I feel better afterwards? So there are some key issues when we talk about service delivery. We know the package, the benefit package, right? What kind of services are being delivered? One of the reasons why people don't use primary health care centers in Nigeria, for example, is because they feel like, you know what, the kind of services I get there is not good enough, right? We have infrastructure problem, we have management problem, we have safety and quality issues, and of course, the demand for care. A lot of people would still rather go to the traditional caregivers and all of that rather than going to the hospital because they feel like, you know what, it's going to be more expensive, or why don't I wait till it's very serious before I go to the hospital? So these are some of the key issues that affect service delivery. Let's go to the next one, the next building block. So health workforce. A well-performing health workforce consists of one, HR management, HR skills, and HR policies. And I can tell you for free that one of the sectors where this is missing is within the healthcare sector. I remember going into house job. I'm not sure we had any form of HR information or anybody approach us before we even started in the hospital to give us proper HR or human resource conversations or even skills, right? Telling you this is how it works in the facility, this is the policies we have, right? I feel like in the health sector, it's one of the sectors that we really lack proper human resource management. And some of the issues we have with that are the policies that we have are currently not being enforced. They still need to advocate more. And people are used to norms and standards, right? People are used to their own norms. They don't want to, do anything new. They want to continue doing things the way it's been done before. So those are some of the issues we have with the health workforce. And of course, we have the JAPA syndrome, which is another issue. The health information system, which is the third building block. A well-performing health information system is very important. It's a very important building block. And some of the importance comes in play when you look at production, dissemination, and use of timely and reliable information. So think about it this way. The human body is dynamic, right? Different things change. If you give the same drug to different patients, they could react differently to that same drug, right? So the question is, based on what information are you prescribing what you're doing, right? Do you have the right information? That's at the doctor-patient level. Now, at the level of the leadership and governance, let's say the policymaker level, the question is, how many patients are we seeing in every facility, right? How many beds, how many patient beds are being filled? How many times or how many days does the patient use on bed? What's the cost per patient? So those are some of the questions that data needs to answer. And that's why I said, for the person that knows how to use R and Python, the reason why we're deploying electronic health records is so we can collect data electronically and analyze. So it's not just about getting that data, it's about being able to analyze that data to make sense, right? To be able to inform decisions at the policy level. And also, they have national platforms that are also used. Because of time, I wouldn't dwell too much on that. Let's go to the next slide. Medical products vaccines, and technology, right? When we talk about medical products, vaccines, and technology, we're talking about ensuring that there's equitable access. Like I said, whether it's the richest person, like Dangote, or it's the poorest person, the person has access to that paracetamol, that antibiotics when they need it, right? Has access to that injection, that anti-malaria when they need it, right? And that they are assured that quality, that the drugs that they are buying is good, right? There's been issues where people complain or people come down with kidney failure because they've gone to markets to go and buy some drugs that are fake. So the question is, how do we ensure that, or how do we assure people that the quality of what we're selling is actually top notch? And one of the ways we do that is by logistics management, being able to ensure that whatever drugs is being supplied at the facility is traced to a reputable producer, right? And also cost-effective use, not just prescribing 5 drugs for a patient because they feel like, yes, the 5 drugs will be useful, but being able to choose which is best for the patient and cost-effective for the patient at that point. So those are some of the issues when we talk about medical products, vaccines, and technology. Let's go to the next slide. Financing, so I don't take too much of our time. A good health financing system is very important when we talk about the building blocks of the health system, right? How do we raise adequate funds for the health sector? If you think about it, one of the reasons why people leave Nigeria or doctors are leaving Nigeria is because of the remuneration. You feel like, how much am I being paid, right? But when you think about it, where is the money to pay the doctor coming from, right? For now, because patients are paying out of pocket, we heavily depend on how many patients come into the facility per month, per year, right? To say how much is being made. Now, apart from that, there's also the part where how much is the government putting into the health sector, right? How are we funding the health sector? How are we be able to protect people from financial catastrophe? How are we able to allocate whatever resources we have and goods and services in ways that ensure that we have quality, equity, and efficiency? And one of the issues we have in Nigeria is we don't have an effective health insurance or health financing system or policy in place, or we didn't, right? Currently, there's one being that has been passed, and I'll share that as we go along with the slide. And also tools and data on health expenditures are also now available. So the last one, leadership and governance. Effective leadership and governance ensures a few things. One, strategic policy framework. Like I said, leadership and governance sits in the middle of all of these building blocks that I've mentioned: service delivery, financing, human resource for health, health workforce, health information system, and all of that. The leadership and governance sits in the midst of all of this and coordinates it, right? So there's a need for effective oversight and coalition, right? To coordinate, to make sure that they speak to each other and they're able to achieve the goal. And they provide appropriate incentives, right? To ensure that whatever policy is being made, people are able to key into it, right? And they pay attention to a systemic design and also accountability. And one of the issues we have in Nigeria is that policies are not harmonized and they're not aligned across the various players, like I mentioned, the various stakeholders. And there's a need for the leadership to ensure that there's coordination across these various stakeholders to ensure policy implementation at every level. Next slide. So I've talked about the building blocks, and I've also kind of introduced how poor the Nigerian health system has been for a while, even though there's a lot of progress currently going on. Now, in terms of strengthening the health system, when we think about strengthening the health system, we have to focus on every building block that I've mentioned, right? The 6 health system building blocks are important, and managing their interactions in ways that achieve equitable and sustained improvements. I'm sure you've heard me say a lot around equitable, right? If there was no proper coordination of the health system, only the rich will be able to access care with the rate of medical costs, right? The poor won't be able to access care. So it's very important to ensure equity across the health services and also the health outcomes. So this diagram just shows how every factor or every building block works alongside the leadership and governance, right? To ensure coordination across government, clients, and providers, and also lead to an improved system performance, leading to what results you need, which is increased access and use of quality health services, thereby leading to better outcomes. Now, let me just make a statement here. When you talk about the demand of health for health care, right? You say in the statement health economists use, the demand for health care is a derived demand for health, right? And what that means is that the patients that comes to your facility isn't coming because they want to access healthcare alone. It's because they have deviated from their normal health, right? And they are looking to be restored back to that normal health. So that's why I say the demand for healthcare is a derived demand for health. So what it means is that the patients want health, right? But to get that health, they need the healthcare services you're able to provide to be able to get that health. And that's why the focus should be on improving the health outcomes of the patients rather than whatever services you're providing. The goal should be tied to, at the end of this service, is the patient's outcome improved or not? And funny enough, we don't take patient-reported outcome measures in Nigeria. We barely do that in terms of data collection to say, okay, you've gone to this hospital. At the end of the day, how do you feel afterwards? Can we take a survey of the patients that are coming to this hospital for this year? Let's see how they feel, patient satisfaction. You know, the way the banks do, or even the phone companies do, software companies collect feedback from their patients. We barely do that in the health sector, which is a problem. And that's why I said health information system is very, very important. Next slide. Okay, so the next slide is just my kind of joker, right? I think I should chip in that while I was in Babcock, the first time I went on scale was while I was in Babcock, and I don't know how many people have seen my profile before, but yes, I'm currently a bald young man. But anyway, that's just by the way. It's only responsible boys that are bald. Yes. So I've talked about health system. I've talked about the building blocks of a health system, and I've talked about how when strengthening the health system, there's a need to focus on all the building blocks, which I have mentioned. Now, let's talk a bit about health policy before we round this up, right? So when we talk about health policy, what does it mean? I mean, this is a statement that's been thrown around a lot. Policy, what does it mean, right? It's a simple definition by WHO says a health policy is a written expression of goals for improving the health situation, the priorities amongst these goals, and the main directions for attaining them, right? This breaks it down into three different parts, right? The first part is you express goals to improve health outcomes. For example, sorry, can you go back to the previous slide? Yeah. I want to reduce maternal mortality in Ogun State, or I want to reduce maternal mortality in Nigeria. Well, that's a goal, right? And then you now set the priorities that would help you achieve this goal, right? And then what is the main direction that you have to go? All of this will form a health policy that will go to address maternal mortality. Now let's go to the next slide, right? So this just shows us what policy does, right? In this health system that I've tried to explain so far, right? What policy does is it gives the system a direction, right? Where are we going to as a system? Whether you're the payer, whether you're the provider, whether you're the one that makes the drugs, whether you're the one that pays, right? Whether you're the one that makes policy, right? What that policy does is it guides all of us, gives us a direction of where we're going to. And that's what I try to depict with this picture. Next slide. Now, one of the issues we have when it comes to policy making, right, is there's a lot of policies. If you read the National Health Act, right, there's a lot of policies. I was privileged to attend the National Council on Health in Maiduguri last year. And that's one of the places where they review health policies, right? Every state brings whatever memos that whatever they've implemented at the state level to the federal level to say, you know what, we are proposing, we've done this in our state, it works, and we're proposing that this should be adopted at a national level. But the question is there enough evidence to back that policy that you're proposing? And that's where we have issues in this part of the world, making policies based on evidence. And that's where data comes in, right? How much data do we use when we make our policies? Now, for you to be able to adequately make a policy that is effective and that will be adopted, right? You need to understand the environment, right? And how it's changing. You can't do a policy that would affect the people in the rural area, for example, in an adverse way, or favor only people in the urban area. That's an issue, right? And then you need to look at what the likely effects of those policies would be like, right? And you need to show clear lines of arguments and evidence between what we are aiming for and what we are doing now. So you would say, this is what we are currently doing now, and this is where we are going. Now, you might think, why should I be hearing this as a medical student? It gives you an understanding of where you can key into following your medical school. For example, I don't practice. I'm not a content creator like Dr. Wills, right? I'm a health economist. But it shows that the sky is wide enough, right? There are so many places where we need people, right? People that have medical knowledge, but beyond medical knowledge now go into how can we improve the health of the population, not just the patients, right? That's where policy comes in, right? And then determine what we need to meet those goals. And most importantly, it's not just about setting a policy or creating a policy, or the commissioner or the minister says, this is the new policy. It's how do you influence the people that need to help you achieve the goals of that policy, right? Who are the people that need to be involved to ensure, is it the doctors, the nurses, is it the pharmaceutical companies, is it the service providers, is it the people that are paying, is it health insurance? So those are factors that need to be considered when making policies. And that's why I said it's important to have evidence, right? Good evidence in terms of data while making policies at the policymaker level. Next slide. So let's look at what a policy cycle looks like, just as a summary. I won't go too deep into it. So I think I've summarized this also in the previous slide, right? The first step is identifying a problem. For example, let me use anti-malaria, for example. So let's say I noticed that people are coming down, or there's a lot of anti-malaria resistance, right? The drug isn't working anymore, and it's because the community pharmacists, the people, patent providers, medicine vendors that sell drugs along your streets or different streets, right, are selling to the patients without testing whether they have malaria or not. So I've been able to identify a problem. Now, the next step would be constructing policy alternatives or policy formulation. How do I ensure that these people stop testing, stop treating without testing? How do I ensure that there's a test before treat at the community level? So you start to construct what alternatives, what content needs to be in that policy to make sure that it is achievable. Now, what is the choice of solution, right? So what's the solution that you're going to provide? Then how do you now design this solution for it to work? Now, beyond designing, how do you implement and monitor? One of the issues is we don't just implement and go away, right? You need to be able to come back regularly to say, this policy that we've implemented, is it working? Is it giving us the desired results? And it's one of the reasons why it's important to take a baseline data before you implement the policy. So that's like a pre-implementation data. And let's say you come back after 1, 2, 3 years and you collect another data. After 5 years, you collect another data to see if what policies you've implemented has actually led to an improved health outcome. Because like I said, every health policy is supposed to improve the health outcome. And the last part is evaluating what you've done, right? I've implemented a policy. How do I evaluate this policy? So monitoring is done during the implementation, right? While evaluation is done at the end. I fully implemented this. Let me now evaluate if this policy was even worth it or not. And this also provides job for people like me, right? The health economist, right? Because you, as a health economist, we have an understanding of the demand and the supply of health, right? We understand that there are two sides to it. There's the patient part and there's the supply part, right? And using data, you can now show to the policymaker that, okay, these are the right decisions to make considering this cost. So we look at health outcomes across costs. So those are some of the opportunities that come into play. And I would say it's one of the things that has also helped me to get my role as the technical assistant to the Commissioner for Health in Ogun State. So if you're thinking about it, yes, health economics is a good career path. Let me just keep in there. So next slide. So we can start to round up. Some of the challenges when it comes to implementing policy, poorly developed justification, right? Like I said, without data to back it up, someone just wakes up and says, oh, I think my people are not benefiting enough. I think they need an advanced life support ambulance in my village, right? Just because that's what I think. It's not backed by data. If you can show me that these are the number of accidents that are happening, these are the type of cases, these are the number of deaths, this is waiting time before they get to the facility. If you can put an ambulance there, this is what it's going to achieve. So that just gives you an idea of some data that can influence decisions. Now, poor sense of ownership is another issue, right? Failure to sufficiently engage all the necessary stakeholders. If you're going to implement something, you don't want one of the stakeholders to kick against it because they feel like they were not carried along initially. Now, another thing is whatever policy you implement or you want to implement, there's going to be some level of funding that needs to go into it to implement, right? So it's not just about saying it or the commissioner sitting in our office and writing it down. Some people need to go carry that message into different communities, different facilities, and make sure that that policy is implemented. That requires funding. Now, conflict of interest can also come up, right? One policy is conflicting with another one and all of that. So it's always important to look at what are the existing policies that speak to that particular problem and how does this new policy affect it. Now, responsibility is not being clearly defined, weak or lack implementation plan, poor coordination, and even lack of political will. I feel like one of the issues we have in Nigeria is, there's been increase in the salary. There's been times when there's been increase in salary, but at the level which would benefit or would get the doctor to stay back in Nigeria, I don't feel like there's enough political will to push funding into the healthcare system to get to that level. And that's one of the places where political will is lacking. But I tell you this, it's gotten better, especially with the current Minister for Health, Professor Ali Patin. Is putting a lot, and also the president has started to put in a lot more into the health sector. And the results might not come out now, but in a couple of years to come, I'm very sure that the healthcare system would get better. Next slide. Now, so this is another breaker before I round up my slides. Yes, I remember in the previous one, I said I was bald, and maybe some people did not believe, but yes, this is my bald head in my office. And well, the important message here is what is behind what I hung behind my chair in the office. I hope you can see it. It says think big. And I put this every day so I can come in and look at it. And if there's a message I would give all the medical students that have decided to join this today is think big, right? Think bigger than your current lectures, think bigger than your current field, right? There's someone that said he's been able to learn a lot about data and data analysis using coding and Python, right? That's one of the options, right? So the idea is every day you show up, make sure you show up thinking big. Don't limit yourself. Have an open mind. There's nothing that is impossible. When you adopt this mindset, will change the health sector for good. Next slide. So to round up, I've decided to share two policies, right? Actually, the next just one policy, but one. The first part is to share the current strategic blueprint of the Nigerian health system as it stands right now, from 2023 to 2026. under the current government. And I feel like it's important for you to know, even at the student level, right? Maybe you would even be the ones to educate your lecturers and your doctors tomorrow, or when you get back to your clinicals, to say, oh, I have an idea of where the Nigerian health sector is going or tending towards, right? Let me just summarize this. So there are 4 pillars that are currently guiding how the Nigerian health sector is moving. Like I told you, policy gives direction, right? What this does is it helps coordinate the health system from the federal level to the state level to the local government level to the community, right? And even the private sector, to see how are we all thinking? What are we focusing on? At the top of it is to save lives, reduce both physical and financial pain, and produce health for all Nigerians. And some of the outcomes we want are: one, DALI means daily adjusted life years, improvement in daily adjusted life years, the number of lives saved, how much we can reduce out-of-pocket spending from patients. So those are some of the metrics that are currently being used to measure. So if I come back in 2026, how do I know if these have worked? So some of the pillars, so there are 4 pillars: effective governance, which covers leadership. Like I told you, the coordination is very important. Efficient, equitable, and quality health system, right? Then the third one is unlocking value chains, and the last one is health security, right? I won't go too deep into it. If you have a chance, you can take a screenshot of this so you can read into what makes up the different pillars. But if you look underneath, you see 3 other things, right? Data and digitization, financing, culture and talent within ministries, departments, and agencies. And these are the enablers, right? So I told you the 4 on top are pillars, the 3 under are the enablers. And what that means is I have pillars which show my goals. The question is, how do I get to this goal, right? One of it is by digitizing the health system and having a data-backed decision making, right? If you're using data to make decisions and the data is accurate, right? It completes the different qualities of a data, right? You're sure that whatever decisions you're making is based on what is actually on ground. And that's where data is important, right? If you look at some of the issues Nigerian health sector is facing, some of it focuses on data. We don't have enough data to make decisions, and we don't even have enough data to measure where we are right now compared to other countries that have gone ahead of us, like the United Kingdom, Norway, France, Germany, and all of that. Now, the second one is financing, right? Everything to achieve all of this, you need money. Increase effectiveness of spend and alignment of spend with strategic priorities, making sure that the money is going where it needs to go to achieve the results you need to achieve. And behind all of this is the culture and talent, right? A lot of us today will be the leaders tomorrow, right? Whether it's at the ministry level, at the states, or at the federal level. It's not all of us that would stay in clinicals. And it's very important that whatever culture, right, that we're carrying into this system is the right one. And that's why I told you, think big, don't limit yourself. There's nothing that's impossible. And the goal for the Nigerian health system is also to strengthen the capabilities and values and drive a performance-based culture within the Federal Ministry of Health, of course, from federal to state to local government level. But the idea is pay for performance. We've not gotten there yet, but that's the goal. Let's be able to tie our payments to the performance of our health workers. Next slide, please. So one of the important policies, right, that have been implemented or that's currently being implemented is the National Health Insurance Authority Act, right? I've spoken about being able to access care without going bankrupt, right? And on the 19th of May, 2022, the National Health Insurance Authority Act was signed into law. And if I ask anybody, I'm sure a lot of people don't know about this, but what this does is it has made health insurance compulsory for every Nigerian, right? It means every Nigerian must have health insurance. And health insurance means every Nigerian should not have to pay out of pocket for care, right? They should already be covered to access care. So if they have an emergency, that's not when they are looking for money. They already know that they have a health insurance scheme that provides them access. If they need to see a specialist, they don't have to start looking for where to go and find a specialist. They know that since they are covered under health insurance, their health insurance will give them access to secondary services. Some of the provisions: enforcement of health insurance, prescription of the minimum package, designation of social health insurance, which is what we're currently implementing. Also, designation of private health insurance as a complementary or supplementary health insurance, and also establishment of the vulnerable fund. So I just noted that so you can maybe go back and look at how this policy is correctly being implemented. I'm sure if you go online and type it, you see how it's been implemented. So to close, I'm from Ogun State and I work in Ogun State. I'm sure it's not everybody on this call that's from Ogun State, but I'll use the mantra of my governor, right? He says, building our future together, right? I'll use that to close. And what that means is it's not just about who is at the top. It's not just about the minister. It's not just about who sits at the ministry, right? It's everyone. My boss would always say something. If the gateman at the front of the hospital treats the patient badly, there's already an effect on the health outcome of that patient. That's the gateman. Talk less of when that person comes to the medical records or comes to the nurses or comes to the doctors, right? So if we want to see an improved health system, it's all of us together. It's not just pointing fingers at the government. It's making sure that whenever you come out of school and become a practicing doctor, or even right now when you show up to your different classes or clinicals, you're able to start to look at what problem can I solve? What problem am I seeing? How can things be done better? And I would say this, there's no amount of money that they can pay a doctor in Nigeria right now that is worth staying back in Nigeria, to be honest. I remember when I came back to Nigeria, 3 of my colleagues were at Olabisi Onabanjo University Teaching Hospital working. Between when I came back, it's just been over a year, 3 of them have left. I barely have any of my classmates in Nigeria. But that goes to show you that there's no amount of money. I don't know how much they currently pay different levels, even consultants, that will keep them in Nigeria. And this shows or points to the fact that medicine is not just a profession, but it is a calling. And there's a book by Miles Monroe that always speaks to my own purpose, right? And that book says, in pursuit of purpose. It just speaks to the fact that everyone has a reason why they are where they are at the moment, right? Whether you believe it or not, right? Everyone has their own role to play. So what I want you to go home with is, what is my own role to play in improving the health system in Nigeria, in Africa, and even the world as a whole? Next slide. Now, yes, so this speaks to what I said previously. So rationale for focusing on health system, thinking big. This patient has fever, headache, and is vomiting. What would you do? How will you treat the patient? What really are you doing? Are you treating the patient's symptoms in terms of, oh, this patient has cough, has running stomach, or are you addressing the patient's health as a whole, right? So look at the patient as a whole system. Financial, the service delivery, the information, the data you're collecting, it's a whole system. It links to a bigger picture, which is universal health coverage. So when you go back to whatever, wherever you're going back to right now, go back thinking systemic. How does my role influence the system as a whole? I believe this has brought me to the end of my presentation. Thank you so much. If you want to reach out to me, please, on LinkedIn, on Instagram, on X, I put my handles there. And just to, next slide, just to acknowledge a few people. One is my late dad, who I recently lost, late Sir Felix Sidikin of blessed memory. The second is Professor Adeshegun Fatisi, whose slides I also stole to present to you because he taught me about health policy and also the building blocks. I picked some of the slides from the Federal Ministry of Health and the SWAP office, NiMSA and EOhealth team, and of course my boss, Dr. Tommy Coker, and the entire management and staff of the Ministry of Health. Thank you so much for your time, guys. I hope that I've been able to share a bit with you. And of course, yes, the world for Broad Street. Thank you very much. Questions, questions, questions.
Thank you very much for that very amazing presentation and training. And I must say that I'm actually proud to be a product of Professor Deshegun Fatisi. It was the just
Fantastic.
yeah, it was our he has not been replaced, but he was our vice chancellor. So I'm proud to be a product of his tenure as well.
Me. Thank you.
Yes, thank you very much, sir.
Doing?
Very insightful one. So if you have any questions, I would like us to raise our hands. I can see one hand. I would grant you access now. Grace Paul, you have the floor. Please ask your question. You need to unmute yourself and ask your question, please. Yes, Grace, go ahead. Grace, you can go ahead now, please. Please unmute yourself. Okay, I don't know if she is going to ask now. Let's ask Jessica. I'll give you permission now. Please ask your question. Please unmute yourself and ask your question.
Good evening, sir.
Okay.
Hello.
Good evening.
So,
hello. Can we take Grace? Can we take Grace? Then Jessica can come afterwards.
Good evening, sir.
Yes, good evening, Grace. Please go ahead.
You mentioned something about every Nigerian being entitled to the health insurance, but not everyone knows this. And I'm asking how we can have access to this health insurance and how we can make it more public and for people to be more aware of it.
Okay. Do you have any other one? Or I can go ahead and answer that.
No, sir.
Okay. So you're correct, right? This policy has been passed since 2022, and in 2025, there's still a lot of people that don't know about it, which speaks to one of the problems I mentioned initially, that in terms of implementing the policy, there's a need to carry people along. However, it's not that the government hasn't been putting efforts. Now, let me just speak to the different types of insurance we have in Nigeria. So we have the government and we have the private sector. For the government, we have social health insurance scheme, and it's as low as 10,000, 12,000, 15,000 per year. And it gives you access to all public facilities and even some private facilities, right? For 12,000 naira per year and 48,000 naira for a family of 4, right? A father, wife, and kids. For the private sector, of course, there are different rates depending on whether you want to buy Leadway or whatever, whichever company you want to buy. Yeah, but one of the issues we have is that people have lived so many years without health insurance, right? So there's a need to build trust. And that's still what we are struggling with, right? I know that very soon, don't worry, let me just chip it in. Maybe we'll get some health influencers like Dr. Wale Apoko to help us push the information, because a lot of people don't know about the benefits of health insurance. For example, everybody will always say, God forbid, but there's an accident, there's an emergency, the patient didn't plan for that, right? But needs to be rushed to a facility. The difference between a patient that has health insurance and the one that doesn't is, if I have health insurance, I get to access care without waiting for payment or saying, oh, where am I going to get the money? But the patient that does not have health insurance is left with how much they can afford at that particular time. And that's why I said it's the knowledge that's the problem. So we're working on it. I'd say if you research more on this, you would see, just look at health insurance plans in Nigeria. And one of the things I have also been pushing is how can we push a message out more for people to know that this is now a law. There's an executive order that backs it up to say Nigerians must all have health insurance, right? But it is the implementation that we are still struggling with. I hope that answers your question. So I can take the next one.
Thank you, sir, for that insightful answer. Jessica, you have the floor. Please ask your question.
Thank you, Ma. Good evening, sir. You actually said a book about purpose, so I didn't really get the name and the title. Thank you.
So it's In Pursuit of Purpose by Miles Monroe. I'll tell Emmanuel to share it with, if you guys have a group, so you can share it with you. But it's In Pursuit of Purpose. In Pursuit of Purpose, by Miles Monroe. And I feel like I would advise everyone on this call to try. There's probably like electronic versions. Try and read it. It speaks to how everyone has a purpose, right? It helps you understand how you can find your own purpose within this health sector that you found yourself. We're all here, right? But we all have different purpose to achieve, right? The reason why I'm not really bothered about my other colleagues that are in clinicals or some that are in health influencing is because I've been able to identify my own purpose. So I would advise everyone to go through it, and it will help you actually identify, especially for people that are doubting, why am I even in medicine, right? Please read the book and it will help. Yeah.
Thank you, sir.
Thank you
Welcome.
very much, sir, for the answer. Then the next question is from Oluwadarasimi Adibesi. You have the floor.
Thank you, Favor. Hi, good evening, sir. Thank you for such
Mhm.
inspiring session. Yeah, so my question is concerning the insurance scheme you mentioned. I believe it has like an age limit because back home from where I come from, there's a limit to it. Once you are past 18, you don't have access to NHIS again. So what like is that supposed to be and is it right?
Okay. So just to correct that, so what happens is while you were below 18, you were captured under the scheme of your parents, right? So when I said 48,000, for example, is for a family, the husband, wife, and 4 kids, right? Those 4 kids are 4 kids below the age of 18. By the time one of them gets to 18, that person is considered an adult and needs to go and enroll for their own individual plan. So that's what happened with yours. And currently, we've even moved from NHIS to the states, different states now implementing their own state health insurance. But it's still the same rule guiding it, right? Once you're 18, you have to now go and get, as an adult, get your own health insurance plan. It doesn't come under your parents' package anymore. So that's the reason why.
Okay, thank you so much for the clarification.
You're welcome.
Thank you, sisters. And our final question goes to Abib Olaliko. You have the floor, please.
Thank you very much, ma. And thank you very much, sir. My question is that earlier on in the lecture, you were talking about policy implementation. So my policy implementation, my question is that because presently my school is currently undergoing community posting, so community health posting. And I've noticed that in the PHC, the primary health care center we go to, like there are a lot of interventions, but like there's no really a kind of something to sustain some of those interventions. For example, now they have like buses, sometimes they even have like all these mechano generators, but there's really nothing to like actually like sustain those things. So my question is like how do we like rectify that? So that's my question, sir.
Thank you very much, Habib, for your question. And it's a very good question. I would even give you my own personal example. Um, at some point, the governor bought tricycle ambulances, about 80 in the States, and gave it to PHCs. And I won't lie to you, at some point they couldn't even find them anymore, right? It was a question of where did they go and pack it? Who is supposed to be in charge? And this brings me back to your question, sustainability. And that's why I said we all have our role to play. Now, I use this case that I just said. For the governor, in his own mind, there was a requirement for putting tricycle ambulances, right? And he has committed to that by procuring the ambulances. But the question is, who is supposed to be responsible for making sure that those ambulances work? Now, at various levels, let's start from the primary health center. There's someone in charge of that primary health center. But that person probably just comes to work and sees work as, you know what, let me just come make my money and go. Doesn't see it as, you know what, whatever has been provided, whether it's digital ultrasound, whether it's ambulance, whether it's mechano generator, right? It's been provided to improve the service delivery of that facility. But like I mentioned when I identified the various building blocks, right? So if you provide, let's say, that amenity for them, there's also the people factor, right? The people that are supposed to use it. What's their mindset towards what you're doing? How are they going to ensure that what you've given them is going to be put to good use and is going to be maintained on the long run? So the solution to this problem is more of a mindset shift, right? There's a change management that needs to go on within the health sector and within the, not just the health sector, right? Even the civil service, right? The public servants, the nurses, the people that work at these primary healthcare centers to say that, you know what, we need to own it. The ownership of whatever policy or whatever implementation has been done is very important when it comes to sustainability. If the head of that facility can take ownership of that intervention, trust me, there will be sustainability. And that's where the problem is. So I would say it's more of a mindset issue, not necessarily, you can't enforce it. Yes, you can put some incentives to encourage people, and you can also put some rules that when they break, they get punished. By the end of the day, it still boils down to having an open mindset to ensure that you identify your role in making sure that whatever intervention has been implemented under you is sustained. I hope that answers your question.
Thank you very much, sir. Thank you very much, sir. I understand.
Thank you very much, sir, for that very insightful answer. So we have one more question. I don't know if you would like us to take it or
please go ahead. Let's take it.
All right. Zany Grace, please. You have the floor. That's the last question for tonight. Thank you.
Thank you. Good evening. Please, my question is about finding out about these health insurance companies. Like how do we know what they are, what they're about? Just how do we access them, both the ones in the public and the private sector? Thank you.
Okay, thank you. I like that a lot of questions are around health insurance. And just to chip in, please, I believe everyone on this meeting, after this meeting, should be an ambassador for health insurance. Go home, tell your brothers and sisters, your dad and mom, that we can't fund the health sector if there's no health insurance. The money that is being collected is not just collected so the patient can access the care. So there's a pool of funds that can also be used to improve the sector itself in general. So please be ambassadors of health insurance moving forward. Now, back to the question. For now, when it comes to the government health insurance, you just need to go and look up what your state is doing, right? Whatever state you're in. I'm in Ogun State. Ogun State has Ogun State Health Insurance Agency, OPSHA. Lagos State has LASHMA, Lagos State Health Management Agency, right? So each state has been allowed, so before it used to be NHIS, which was Federal Coordinating Health Insurance, and they've seen that that isn't working. So they've let every state at the subnational level create their own health insurance agency, which is still under the national, right? And also they now coordinate the health insurance within their states, whether private or distant, they can also coordinate. Now, for the private health insurance, you can always look online. There's a lot of them. they are one of the problems, but I'm not going to go into that. But there's too many private health insurance currently. You have Leadway, Reliance, you have Avon, you have, AXA Manza. There's a lot of them. So if you just type private health insurance in Nigeria on Google, I'm sure you see a whole lot of insurance companies. So whatever you're looking for, I believe we're in the digital age. Just go on Google, search it. You would see that there's currently health insurance being implemented in Nigeria, and there's also private health insurance that has been in existence for some time now. So I hope that answers your question.
Yes, it does. Thank you so much.
You're welcome. You're welcome.
Thank you so much, sir. Thank you so much, sir. So I want to say for the remaining questions, please just send your questions on the group. We'll relate to our speakers. Thank you so much, everyone, for joining. I want to send a special appreciation to our speakers on behalf of Emmanuel Owolabi, the convener, and on behalf of Oladikon Samuel, the programs coordinator. And I want to appreciate Dr. Olawale for staying even up until the end of the presentations. Thank you so much, Dr. Olumuyiwa. We really appreciate you honoring our invite to speak to us. And we've definitely gained a lot from the training for today. Today is the first day and it's been a whole lot to take in. Yes, it's been a whole lot. So we look forward to next session. Next session will be holding next Sunday, April 27th. And I want us to mark our calendars and be present. Tell your friends who are not on the call today not to miss next session, because you can see how insightful it was. You can see opportunities flying here and there. So, and for those who have pending networkings, please make sure to reach out to the team. Make sure to speak up on the group so your opportunity doesn't pass you by. So thank you very much, everyone. We've come to the end of the session. Okay, sir.
Just to chip in for everybody, please, if you're interested in health policy, data analytics, digital health technology, health innovation in healthcare and all of that, please feel free to reach out to me. I've shared my handles. I could share my email with Emmanuel. I'm ready to, it's just this period that I'm busy, but afterwards, I'm sure that I will have time. So we can all start to think of how we can come together and provide solutions to the current problem, because the truth is we can't all run away. So please feel free to reach out to me, and I'll be able to share more information with you. Thank you. Thank you, Favor.
Thank you, sir. So make sure to connect with both our speakers. Their handles will be communicated on the group. So make sure you network with them, make sure you connect with them, follow them on IG, on X, and send connection requests to them on LinkedIn. And I'm sure they're going to respond. Thank you so much, everyone, for waiting to the end of the training for today. See you next week. Have a lovely week ahead. Happy Easter.
Thank you. Bye.